Hello, Namaste. I'm Umesh Roniar. Welcome to my channel Health Insight by Umesh. Today I'm going to talk about why interpersonal skills is very important for doctors, medical profession. As you know, the doctors are dealing with patients one to one, and not only with the patient, they are dealing with their parents, relatives, friends, and attendants, whatever. So it is very important for them to have this particular interpersonal skills. What it does, it is very crucial, skill for a doctor. What it does, it improves patient-doctor communication. So what happens when doctor make them empathize or doctor empathize them, they are with them. So they start telling you all the problems. And what happens, so that because of better communication, you are able to diagnose the real problem or disease. Sometimes patient hide so many things because they are accompanied by their guardians, parents, or maybe somebody else. So once you are very familiar with each other, communication is proper, the patient start telling you everything that you need for diagnosis. So this is very important, and accordingly the trust is built. So once trust is built, you both are in the same track, and that is very good for medical practice. Besides this, um, I've seen doctors, like telling, if you smoke, you will die. Instead of saying this, if you say, see, since long you have been smoking, and it might have done a lot of damage to your lungs, and as you know, it leads to a lot of respiratory problems, cancer, and so on. So, who are with your family? Who are in their family? Wife, kids, parents, they are all depending on you, right? So, suppose after 2, 3 years, 4 years, if the things get complicated, how, whom they will be dependent? Just think. So, the difference is if you smoke, you'll die. And instead of telling that, if you say like this, the patient might think, because it is not only him, it is his family also. So this interpersonal skills is very helpful, and for patient and doctor relationship, better diagnosis. It also helps when you are working in a medical setup or hospital, nursing homes. There also you have to deal with nurses, junior, peers, seniors. So if you will have a proper communication, there also you can provide better patient care. And these are basics, but it is very important to improve your practice. And I've seen there are so many doctors because of this, it is like so various people, they have inbuilt this interpersonal skills. They can very comfortably motivate people, and they can put them in their track. So it is by birth somebody has this type of skill, but it can be developed in other persons also. So it is not a very difficult skill. It also resolves like conflicts and all. And finally, the patient experience is wonderful. That is what you need. So once what happens in branding, when you see branding, so we say advocacy. So once one patient starts advocating you, you are a very good doctor. Why you are a good doctor? Because you listen him very carefully, consciously, and you are showing empathy. So this is main factor, nothing else. So diagnosis comes secondary. So this makes patient advocating you to others, and that makes the picture totally change. Okay. And one thing finally I would like to tell is like cultural competency. Suppose a doctor from Tarai comes to Kathmandu, or a doctor from Kathmandu goes to Tarai. So there will be cultural differences, there will be language differences. I have seen Nepalese doctors speaking frequently Maithili, Bhojpuri, Marwari. You know why? Once you are in the same language, you are talking in the same language which your patient belongs to, they feel very comfortable. So the cultural competency is equally important. And this is all about interpersonal skills. I hope the episode will give you certain message which help you to increase your professional practice also. Thank you.